And welcome, folks, to the Free Market Cash Patient Weekly Webinar Series. Jeff Cantor, my co-host, who is out on vacation, I think somewhere in North Dakota right now, and I have been hosting these things nonstop for at least 2 years, including an earlier 4 p.m. Liberty one that's more broad, and this one, 7 p.m., is more focused on healthcare, although as a microcosm of the world, healthcare is such a cartel and need of reform that the type of speakers we have are broad, whether activists trying to fix the laws gumming up the works or the disruptors and entrepreneurs taking the Ayn Rand Atlas Shrugged approach to just build a better mousetrap and taking all the customers with them. We want a better world, a more open world, and we want to introduce to all the buyers and sellers out there, our fellow humans, to these leaders, these thought leaders, these creative innovators whose genius we need to get to where we want to go. Let me just quickly share my screen so you can see the home base here at your-mp.com. Your-mp.com. Just come here and click the home tab and down to continuing the conversation to hook up with any of our past speakers. Again, we go back well over a couple years. And if you get to YouTube, our channel is Free Market Cash Patient, and you can scroll down and see some of the best thought leaders. Lots of integrated care leaders. That's kind of the general theme of tonight. Although tonight has a twist, the structure that's going to allow a better proliferation of this integrated health market that most of us want is going to explode. Again, the speakers go back 2 years. They're just amazing leaders in every area of healthcare that you can think of. That's what we see as our job. So tonight's speaker, if you go to the home tab at your-mp.com and click webinars, we have write-ups on both of our events, 4 o'clock and 7 o'clock. Earlier today, we had a fantastic national leader in sales training on conscious selling. And that's kind of what we're doing in healthcare too. It's about what is the conscious way to approach healthcare. I mean, what should be more conscious than healthcare? And Dr. Knopfsinger is the person to really lead this discussion. He runs a company, Regenerate to Heal, and like a lot of integrated healers with MDs and naturopath degrees, just a wide range of skill sets. They really understand that, especially the real epidemic that we face in the world, chronic disease, is an area where allopathy, pills, prescriptions only are going to get you so far, I think, in therapeutic value. The body, this human experience is a bit mysterious, and there's a lot of success over the generations and centuries over what really works. We can't just throw out old medicine or even new medicine that shows promise, and we certainly can't allow special interests to gum up the works and use government to artificially bar entry for these geniuses if that's what consumers want. We have a right to try what our bodies need, what we think we need. And the innovation that Dr. Knopfsinger has come up with is a private membership association. I may not have the exact syllables right there on what his crowd calls it, but essentially it's a structure using traditional law in this private sphere of your home, your private property, for the healers and the patients to coalesce together and get the healing they want and need without smothering interference from Big Brother. because of the way I said it, we all know that the special interests see Big Brother government as its tool to keep out the competition. That's what it's for. It's nothing about quality or safety. It's about market capture. And like most markets are captured by the special interests through government. Healthcare is no different. And so we just have to do our jobs as Americans with American values to advocate for a more open society to help these entrepreneurs give us what we want, which is answers to our problems. So Dan, with that, I'll turn it over to you.
Welcome, everybody. For the huge number and growing market of patients becoming members wanting alternative treatments for cancer and other illnesses, does the answer lie in private membership associations? And just like Charles was just got done saying, is our healthcare a free competitive market? And I really don't think it is. In 1993, I graduated from National College of Chiropractic, and I went to my first acupuncture seminar. And I thought it was going to be about acupuncture, but it turned out to be more about human regeneration. And this is the man that was my colleague. Well, he was my teacher, later become colleague and friend. He died in 2014, and he showed me, changed my world in how I practiced. This is an article that was written about him. It's called Regenerate the Body with Chiropractic and Acupuncture. John's background is he was in Logan College of Chiropractic, 1969, and there was a Japanese acupuncture that came over, and inside one of their clinics, they had a guy that was complaining of fibromyalgia type diseases. And this Japanese doctor did some acupuncture with him, and he got rid of his pain just after that one treatment. And so John followed the guy around, followed him right back to Japan, in fact, and learned a lot of his techniques that he was using. This is another guy that he learned from, Tanny. He was a cardiovascular surgeon. He was in Europe, and he quit because he found out he could regenerate the whole heart, valve, muscles, nerves, the whole heart, everything came back. Outside of Shanghai, in a small town, it's called Sanchao, China, they were growing eyeballs back from kids that were born with sometimes nothing more than just a bulb, and they'd regenerate the eyeball back. And they said it was either from parasites or bacteria at the time. And Paul Nogier, for auricular acupuncture, that's acupuncture done on the ear. Paul Nogier, he mapped out the ear very specifically. The Chinese did it in the very beginning, but Paul Nogier did it. In other words, he was much more precise on all those different points in the ear. And what he found is whenever you have chronic disease, and it doesn't really matter if you're, doesn't matter what type of physician or practitioner you are, this is just regular classic embryology. So you have a cell from mom and a cell from dad. Those two cells come together and they form three different types of cells. You have endoderm, mesoderm, and ectoderm. And those cells keep multiplying until you have a little baby formed. Well, that process doesn't stop there. It continues throughout your whole life. Cells die and new ones replace it. And the body has this blueprint, this electronic blueprint, that it has an image right down to every single cell and where it's supposed to be. And with chronic disease, that was a huge game changer, because in chronic disease, it's like the body, it's like a train that gets derailed. The body doesn't really remember how to make new cells or to keep them healthy anymore. This is that another time when Dr. John went back to Japan, he studied and they were regenerating the skin. From the atomic bomb, they had a lot of fallout, and he described it as like elephant skin. The skin was really thick and scarred. And what they were using is electricity, and they would regenerate the skin, and the old scar tissue would start falling off and new cells would replace it. And John would get back, and he went from Japan to Taiwan to Europe to Germany to China, a few other places. And he'd come back and he would practice this in his office. And one of his patients was a Vietnam vet. He stepped on a landmine and he had pain and paralysis. And one day, this is after, it took about 2.5 years, 2.5, maybe even 3 years. But one day, John said, it nearly scared the shit out of me. He got up, and when he was turning around, the guy was standing up and actually walking towards him. This is another incident. This happened back in 1980, 81. Girl, she gets silicone implants, breast implants, and she goes from an A to C, gets on the cover of the magazine, but one of the implants leaked, causing metastatic cancer. And she hears about John, goes to see John, and he does his regeneration treatments. And not only does he get rid of the cancer completely, but the breast grew naturally from an A cup to a C cup, just stimulating growth. Another patient that I heard about, that this is after that one seminar that I sat in, sat there listening to all this stuff, unbelievable. Another guy, he had a heart attack, and when you have a heart attack, as you probably know, on the EKG, those vectors look differently, so they can identify where in the heart the fibrosis or the scar tissue is trying to repair up the injury that happened. And when you regenerate the heart, it comes back as a new heart, and this takes about a month to do if it's a fresh heart attack. In other words, that scar tissue, that fibrosis is normal tissue. So even on an EKG, they won't even be able to detect that you even had a previous heart attack. So you're a completely new heart. Another guy that he told us about, he was a farmer, and I guess he had corral some hogs, and from one pen to another pen, he fell back and he cut off the end of his thumb, the knuckle and all. Well, John started doing his regeneration patterns on him, and the knuckle came back, the blood vessels, all the nerves, everything, fingernail, right down to the exact same fingerprint. Everything comes back because you have that electronic blueprint that remembers where every cell needs to be. And the other ones, he actually had 2 clinics going that did nothing but eyeballs. Macular degeneration, cataracts, glaucoma, detached retinas, diabetic retinopathy. These things cause blindness, and you're able to get all the vision back, and you're able to reverse all those conditions. Remember the first time I was shadowing John, seeing the incredible outcomes of the regeneration method, and I was elated coming out of there, but it kind of soon turned to fear a little bit, and it kept on creeping up over the years. The next time that he had the seminar, and there he wasn't talking anything about what could this regeneration stuff do. And I was kind of curious. So when I got back to his office, when I was shadowing him around, I said, you know, why aren't you talking about this stuff anymore? He says, well, you got to be careful. He says the insurance, the AMA, the state licensing board, the federal government, they write the rules and enforce the rules. So the scope of practice, the standard of medical treatment, they all come to play, and they put our license in jeopardy if you go outside of that standard of care. There was actually a Chicago oncologist, and he was treating a lot of cancer with herbs, getting some fabulous results, and he wasn't given the normal dosage of the chemo to all of his patients. And when they found out about this, they took his license away because he wasn't even following the standard medical care. So it really doesn't matter if you're a medical doctor or a chiropractor. If you're treating outside drugs, surgery, chemo, and radiation, and your license could be in jeopardy. And it's a half truth too. Patients aren't given all the information, and it equals to a lie. And I'm sure a half truth, as you guys know, if you're just saying half the truth and you're missing the nuts and the bolts of everything, you're not getting the correct information at all. And doctors are not given that information, not only from the schools that they go to, but the seminars and everything like that, because they still have to follow those guidelines. So that free competitive market doesn't exist in healthcare. Big Pharma, like I said, Big Pharma insurance companies, AMA, the licensing board, they all make the rules, and they definitely enforce the rules. They control the messaging of what chiropractic colleges even teach, what they research, what chiropractors are allowed to treat, diagnose. And most states, if not all of them, they're not allowed to treat disease, or let alone cancer. There are many of the other infections that happen. They dictate therapy for all diseases. Somebody else was talking about COVID symptoms earlier before we got on. They're not allowed, nobody is allowed to treat that stuff except medical doctors in the public arena, and we'll get to that in a second. They don't allow alternative claims to cure anything. They dictate research that would prove the possibility of proving different cures. They even dictate any kind of advertising, especially testimonials out in the market. They prevent information, like I said, from the physicians. They prevent vital information to the patients. They prevent doctors from sharing vital information between physician to physician, because that would be grounds for your license to be revoked too if it was outside of what they consider the scope of practice or the standard of medical care. So the alternative choices in the free market world doesn't exist. In the business model that's currently going on, where they keep people sick and increase the cost of disease as they progress throughout life, and the disease and the pathology progresses throughout life, so does the cost of treating those, because they start getting more radical and more radical with the different types of treatment that they do, which costs more and more money. It's a lifetime patient, and they keep having to spend more money out of their pocket. Another thing that they prevent a lot of times is transparency of outcomes. You don't know what one doctor and his record for treating XYZ disease to somebody else down the street, or comparing that to alternative care. So there's really no transparency of these outcomes. They're kind of protected through the HIPAA. Well, we're not allowed to say anything type thing. And they prevent any kind of money back guarantee. I mean, everything else in life, if you want to get your car repaired or anything like that, there's some kind of a money back guarantee that if they don't do a good job, you know, you have grounds to get some of your money back. That doesn't even exist in healthcare today. So is the free market, it doesn't really exist. And your liberties, are they getting strapped? I kind of believe they are. Robert Becker, Dr. Robert Becker, one of the first books that John gave me when I was starting to study with him, it was called The Body Electric. Fascinating book. I highly recommend it. And he described the fascia as the fascia. If you take away every part of the body, and except for the fascia, you'll still see the whole outline of the body. The fascia is inside of a cell. It's that spider web that holds the whole cell together. It holds organs together. It holds bones. It holds the whole body together. And it's the most conductive electrical force throughout the whole body. And that's where most of your electricity travels through the body. A lot of times people think it's the nerves. And it's not. And I'll get to an experiment that he did here in a second. But all cells regenerate too. That's the other thing. And humans regenerate like lizards. People don't really realize that. But you know, when a lizard loses its tail, it's able to regenerate it right back. Becker, through NIH, National Institute of Health, he was doing some research. And when I said earlier, the humans regenerate as fast as lizards, growing their tail back, and lizards can't get cancer. And I'm going to go to that here right now. But lizards can't get cancer due to the fact that they regenerate so quickly. This is his book. And the experiment that was done on the rat that you see in the bottom right here, what they did is you know how bones regenerate. So if you break your bone, they put you in a cast and those bones regenerate back, right? So what they did is on this rat, they broke it down here, and then they severed the nerves above it. Everything, even microscopic nerves. And they were anticipating that the bone wouldn't be able to regenerate back. And it did without any complications. And he did it with electricity, as you see down there in the corner. Did a lot of experiments. He did it with cats, and he was a pioneer in that field. And this goes back to the lizard. And what they did with the lizard is they kept on injecting them with cancer. And the lizard would just keep regenerating, regenerating, and generating. So because they regenerate so quickly that the cancer won't stay around. And the diagram to your left is the ability to regenerate, like in worms, salamanders, reptiles, is very, very high. So the incidence of cancer is going to be very, very low in them. And it's just not cancer. It's any disease, any chronic disease out there. And man, without the electricity applied, doesn't regenerate. But once you apply that electricity to man, he can regenerate just as fast as a lizard, just like Wolverine. I always forget his name. It's probably not Gene Hackman, but I'm not sure about that. This is
Hugh Jackman.
Who is it?
Hugh Jackman, right?
Hugh Jackman. Yeah, I wasn't sure. I'm not a movie buff, but we have that same capability. This is Bjorn Nordstrom, and he developed a lot of different techniques to see blood vessels in the lungs. Fine needle biopsy is still used today on a lot of cancers. He was also the chairman for the Medical Peace Prize, Nobel Peace Prize. He's had on the board to determine who would get that Peace Prize. he was definitely in diagnostic radiology, and that's where most of his studies went. His theory of electricity forces in the body applied to treatment of cancer. So what he would do is he would stick an electrode right inside the tumor. Everything that he did was in the lungs, and all these people were metastatic. So he would open them up, put the electrode right inside the tumor, stick another electrode right outside the tumor, stick the current right through it, and out of the 20 patients, he had 46 of them had the tumors completely regenerated, completely disappear. 12 out of 26, all were incurable. And his theory of the body is filled with the electrical currents throughout the whole body. He was actually on 2020. I'm not sure if the old timers are going to remember who 2020 is, and Barbara Walters. You young guys probably won't. But he was interviewed on 2020, and I think you can find that on YouTube. But he wrote a book and he presented different places. He didn't write an article. An article is only about 5 to 7 pages. And what he had to present was so much more than that. So he actually wrote a book, and it was scientifically reviewed through Yale. Dr. Glickman of Yale, he was also a radiologist. He spent over a year trying to poke holes in it. And he said it was unbelievable. It was fascinating. And you would think that it would take hold, especially going through such a prominent school like Yale. They would take that and start maybe doing some research on it, but they never did. He ended up going back to China, and he died some years later, and nothing really ever came about from it. This is what I'm talking about, where we really don't get all the, all the balanced information to share with each other. Moving fast forward a little bit, when I studied with John, I spent over 1,500 hours with John from 1993, and he passed away in 2014. And I learned everything I could. In fact, about 2 or 3 months after I did this, I experienced this, I should say. This is, she had, this is only a stage 1 breast cancer. It's about the size of a golf ball. And when the tumor is that close to the skin, it'll pop out just like a zit would. That's how the body heals. And you won't even see scar tissue or nothing. It'll just seal right back up. That whole process took about a month. This is 2 weeks into it, and you're seeing half the tumor. Doing things like this, I was invited for hearings in front of 3 state boards so far. And I don't plan on going back again. And we're going to be talking about the PMAs. But Arnie was another one that I did. In fact, he was one of my first patients. And I remember I was just moved to, down there to Virginia. I was opening up a practice, and I was putting together a desk. And all of a sudden I look up, and there's this guy on the other side of the table. He's saying, "I'm dying, can you help me?" And I'm like, "I don't know if I can, but I know somebody that could." And so I actually brought him to John's seminar. He had Hodgkin's lymphoma metastatic throughout the whole body, and he ended up winning a $4.5 million lawsuit case against Kaiser and his doctor for treating him with chemo and chemoradiation enhancing drugs at the same time, which is a big no-no, I guess. And so he won it, but they kept on going through the appeals process, so we never got to collect on the money. And so I took him to John, and long story short, about a month later, he gained all of his weight back. He's feeling good. And Kaiser says, "Well, we got a master acupuncturist for you to go see." So he went to go see this little Chinaman, and he was treating him. And Arnie came back to me about 3 months later in the same shape that he came in the very first day to see me. And it took about another 2.5 months, and his cancer was all disappeared throughout the whole body. Anne was she had uterine fibroids, and she already had 5 kids, but she wanted more. But the only problem was she had a fibroid about the size of her fist that kept on growing on her uterus, and she'd go in there having surgery, and it'd grow back, another surgery, grow back, and pretty soon when she came to see me, she would wear around sweatpants, and she would hike them up right below her breast line, and she wouldn't wear any underwear or anything like that. She was so sensitive, and it was so painful. No intercourse with her husband for the past 5 years. And so we started doing the regeneration patterns on her. And about a year later, everything was disappeared and never came back again. John he was a colonel in the Army. And it was about the time that Bush was coming into office, and he knew who was who, and they retired him. He had leukemia and colon cancer at the same time. And It was about a month later that they couldn't detect any more leukemia, and so they put him back onto into the Pentagon to help him out there. This is a lady that she was referred to me from an oncologist, a prominent oncologist back in Austin. And if you see on the left-hand side, you see that little, right in the middle, you see that little red dot, or that little yellow dot. That was a sore. It wouldn't stop oozing. And so what he thought was, I'll just radiate her and I'll burn everything, singe it all up, and so it'll stop that infection. Well, it didn't. And so he says, he sent her over to see me, and on the right-hand side of the screen there, you see all that scar tissue, just like what they did in Japan when you stick the electricity to it, and you do the regeneration patterns. You see blood vessels, all new blood vessels coming, and she was even getting all of her sensitivity back where she could start feeling it again. And she was only able to stay with me for about 2 months before she couldn't get any more rides. And she was coming in from about 2 hours away. She was a Medicaid patient. I was treating her for free. And the rides, she couldn't get any more rides. And so she did die a couple years after that. But that was just, I believe, due to lack of treatment. This guy, he was in a motor vehicle accident. And, thank God for those emergency surgeons. They do remarkable jobs. But what they did is they cut his scalp from here forward, peeled it forward, repaired up the eye, which they said would never work again, stitched him up the best they could and flipped it back and stapled him, from ear to ear again. And then he came to see me, and that's him 1 month later. And his eye's working perfectly, and he was really happy. And I said, we can keep going because there's a little more scar tissue that I want to take care of. And he goes, I'm good. He really didn't care about the scar tissue. This is a lady that had a breast reduction surgery done. She was a patient of mine. She went in for breast reduction, and I didn't have a camera in my office. We don't have iPhones back then. But the nipples didn't take. And when she came to see me, it was the staples were holding on the nipple, and it was there was nothing there. And right underneath the nipple, you could see the infection. It wasn't even holding at all. It was just shifting back and forth. The only thing that was holding it in place were those staples around it. And so we did regeneration patterns. This is her after the 3rd treatment. By the 4th treatment, nipple, everything was all perfect. She didn't have to come back anymore. So doing these things kind of got me unwanted attention. And so I ended up going to Mexico, and I worked under a very prominent, he was the assistant director of the biggest and oldest hospital in all of Mexico. It was in Guadalajara. So I practiced under his license freely, and I could do pretty much whatever I wanted to down there. So of course, what I like to do is cancer, but it's not just cancer. It doesn't matter what it is. The body just regenerates, every cell regenerates. And this is I got into a group it's called Kanika, and they're a nonprofit organization. They help out kids with cancer. And this is him. He was terminal on the left-hand side. And then that's him. It does say 4 months later, but it should say 14 months later. They couldn't detect any more cancer in him. Same thing with Alejandra. It was about the size of an egg in her brain. She was terminal, and it took about 14 months to totally resolve her. And this is Carlitos. He was one of my favorite patients. This didn't happen the outcome wasn't what we anticipated. But there is him in the yellow. That's the first day or second day that he came to see me. And they actually took him off the table. They were going to give him another treatment. And they took him off the table, and they said, if we zap him again, he'll die right here. So they didn't do that treatment. And he came to see me. That's him a week later in the red shirt. And then that's him 6 months later. He actually has a fat tummy and doing very well, enjoying life again with his new little puppy. And 90% of his cancer was gone in his brain. He was doing very well. And that was the time that I came back here to the States. There were some problems with the federales going after the cartels, and it was kind of getting too dangerous and missing family here in the United States. So I came back here to the United States. This is Lourdes. She was actually being interviewed. It was like a Good Morning of America show, and they would come in periodically and do some stories on some of my patients. But this is Lourdes. She had cancer in 8 different organs throughout the whole body. Most of the bones it spread through, very extensive. And all the cancer, they couldn't detect any more cancer after about 15 months of treatment with her. And she was, I think, about 60, 65 years old. This is Paulina, sweet gal. 17 years old. She developed stomach cancer. When I seen her, she was about 19 years old, and she looked like she was about 8 months pregnant. And the priest actually took me to her house. They gave her last rites 3 days before I got there. In about a week, she was up walking around eating. Never forget the day her mom was making soup. I treated her at her house, of course. She wasn't able to move out of the bed. Mom was making us soup, and we were eating the soup, and all of a sudden she walks out of the bedroom right in front of us, and no one said anything. She just grabbed the soup and just started eating. So, and her tummy went back down to normal. She was wearing jeans again, and she was having, she missed her teenage years, so she was out with the kids again. And then this is where we get into the practice management. So I came back to the United States, and I didn't want to get in any more trouble with the licensing state laws and scope of practice and stuff like that. And so I did go into somewhat of a depression. And then somebody told me about John J. Singleton, and he specializes in risk management. He's not a lawyer, and he probably commits about 50 felonies a day, and he himself is practicing behind a private membership association. He runs a Singleton Press, and there it is on the bottom if you want to get in touch with him. But he's an excellent person if you ever want to do risk management. And so I wanted somebody that specializes in healthcare. He didn't specialize in healthcare. He was actually, at the time that I called him, him and his son would do the Brazilian Jiu-Jitsu. And so they went to the mall where the club was at, and they were going to meet inside there. And there's him, his son, and there was a police officer out there that's also a student there, and they were waiting to go in, and they couldn't go in because of the violation of the mask laws and the social distancing and stuff like that. And so John Jay just goes, just to do a private membership, and you don't have to abide by the mask, you don't have to abide by the social distancing, because you're now a private membership. In other words, he was describing it to me like this: I can walk around my house naked if I want to, but if I do it outside, I'm going to be arrested. And so there's certain things that's understood. Your family is an understood private membership, but you can have a private membership where it's not open to the public. And once you're in a private membership, the scope of practice laws and the standard of medical care don't exist. The only laws that you cannot go against are anything that has clear and present danger. Like if I'm selling baby parts out the back, or if I'm killing people off or something like that, the police definitely have the right to come in there. So that's basically the rule with a private membership. And there's certain steps that you have to do to differentiate yourself between being private and being public. Like I couldn't give one of you a diagnosis of if one of you had diabetes or macular degeneration or some other kind of disease that you want to get rid of. If you ask me this in public, I can't tell you, well, we can take care of it in a month or 15 months or whatever the case may be, and this is how much. I couldn't do that because I'm in the public domain. So I'd have you sign up as my member, as a private membership in my organization, in this private membership association. And that's where we can share information. I can even teach it. I can even certify you to do this method on other people. So even somebody that's not a practitioner, like a mom, I could train her how to do this, and she could actually do it in her private membership or come and treat other members inside my private membership, because we're outside the public domain at that time. So this kind of goes on. So you can share the knowledges and services with other members to achieve the best possible outcomes for your patient. And I'm sure that there's a lot of doctors listening that have great ideas and they've learned some techniques, but it's not allowed in their state due to whatever licensing laws. So your ability to teach other practitioners to do this in a private membership, you very much can do it, and that would be the way to go. Pro Advocate Group is who I sought out to help me out. They've been doing helping people with their PMAs, and they specialize with physicians. They specialize with practitioners to develop their PMA. They have 50 years of experience. They've been around for a long time. And I myself was practicing this way for a long time, and I never heard about PMAs before. And it goes back to the 1700s. It's called the law of lands. Most countries follow this, where you have the right to associate with other people, and the government can't interfere with that. You have to do it though in a private membership, because once you do it out in the public, you're under those public domain licensing laws, I guess you might say. So what you do is you have public patients and you turn them into members, and then that's when you can share all the information with them. That's their phone number. If one of you guys want to get in touch with them, I highly recommend them. They've helped me and they support me with unbelievable support. It's truly like a family. I can get on the phone with them at any time and they'll answer my call. And they're really a lifesaver. This is the different contact information for my PMA. That's my Facebook ads. And I had to put up Jared here. He does social marketing for small, medium-sized businesses. And then the Pro Advocate Group, and that's their number at the very bottom. Can you guys see that screen okay?
Yeah.
Okay. And I guess if you have any questions, feel free to ask me anything.
Excellent, Dan. And yes, folks, if you want to click the raise hand icon under the reactions button, let's get some questions here. And I'll start it off. Dan, you say private membership associations go back to the 1700s. That kind of reminds me of the sharing ministries that some of us are involved with in this webinar. That's basically the new name for what used to be called mutual aid. And it's my understanding that most people got their healthcare paid for, before World War II through mutual aid organizations, lodge fraternities. You pay a monthly or periodic fee, and then you have a major medical insurance, or maybe an on-call doctor of some sorts. So it's interesting to hear that this PMA structure has been around for so long, and yet most people I know have never heard of them. Can you tell me about some of the other practices, medically speaking, that are using PMAs apart from you? Are they similar to what you're offering? Are they offering different treatments? Is there a common theme in this market?
There's a chiropractor. She lost her license. She was one of the first persons I talked to, and she was up to get her license revoked, but she's like, well, I don't want it back. She's doing everything through a private membership. So she lost her license and she opened up her private membership, and she's able to keep practicing. Different physicians, they're doing things that are outside the standard of care. I don't know them personally, but talking through that PMA, I was able to talk to a few of them before I got started. But it's not just with physicians, it's any business that you want to. Even restaurants could do it. It doesn't really matter what the business is. The private membership, it's universal, and it's been around since the 1700s. But I know there's different ways to skin a cat out there. There's a lot of different alternatives to therapies that work very well, that aren't drugs, that don't have anything to do with surgery, chemo, radiation, all that kind of stuff. And once you don't follow the standard of practice, like I said, if you're a medical doctor or even a different type of chiropractor or acupuncturist or anything like that, if you're doing something outside that scope, then your license could be in jeopardy. And this is the only way that I found in 30 years that can protect you.
And final question, payment. Are folks using their credit cards to pay you, check, cash, Bitcoin, or even health savings accounts? That's the big question, health savings accounts with a tax deduction.
Those are a lifesaver, because you're getting around insurance and what they say and dictation of care and what they can do and what they can't do. We accept the HSAs, any type of payment normally. We can accept credit cards, we can accept cash, any Bitcoin, you can do any of that stuff. And that's a fee that you pay. My fee to sign up for my membership is $15. So they can pay for that however they want to. That's not, it doesn't matter. You can even use your HSA card to pay for it.
And then on top of that, then your services beyond that monthly $15 fee, then it's a treatment cost, a regimen of some amount for some time, correct?
Yeah. In my case, in my PMA, they're paying for healthcare services. And so I charge them X amount of dollars, and that can go through the health savings account as well too. We've used that before.
Wow. Brittany and Joe, I see you got your hands up. Who wants to go first? Brittany, ladies first. Go ahead. Unmute yourself.
There. Okay. All right. Would it be possible if somebody wanted to set up a PMA hospital? So what I mean by that is a private membership association in whatever location that provides, let's say, emergency care to members, and then, you know, whoever comes in, you make people members however you do it when they come in the door, or maybe it's only, you know, whatever is in accordance with the law on PMAs. Would it be possible to set up a hospital under a PMA?
I'm not a lawyer, and that's why I refer you to the pro advocate group. But the way I understand it is certainly, but there are certain rules that you have to follow to make it private. In other words, if I just have my door open and people can walk off the street, it's not exactly private. Mm-hmm. But if they came in to see you, that's when you can introduce and say what you do, and you can do that. And there's really no guidelines against it. When I even said to, when I was talking to John Jay, I said, could I even do surgery in there? He says, yeah, no reason why you can't. And I'm a chiropractor. I don't know anything about surgery or anything like that, but you could still do it. So you're trusting your members and going back and forth that you're giving them the knowledge. I mean, that you're competent in doing it. I would never do anything like that because there's no competency here on this side for doing surgery at all. I'm zero. Taking out the splinter is about the best I can do.
but you couldn't.
Yeah, that would definitely be within that guide, because you're not doing clear and present danger. You're not, like I said, you know, selling baby parts out or killing anybody off. You know, you're trying to help people out, and you can definitely do that in a private membership. Members can help out other members.
Okay, but you couldn't advertise beyond your membership, like you couldn't put an ad in the paper about your membership organization? Or...
Oh yeah, you can. Like I can tell you, like with metastatic cancer, I say on the average we have about an 80% success rate with metastatic cancer, and it goes down to about 50% if they have about a week to live. So I can say in general terms that, but I can't tell you particularly if you have cancer or if you have diabetes or blindness or anything. I can't tell you specifically anything about you. I can just say in general, this is what we do, because you can advertise you can advertise your membership.
Okay.
You just can't give specific diagnosis to people.
Okay.
And they have to sign up first before you divulge any information.
Right, right. Okay, thanks.
Yeah.
Wow. Joe, before you ask your question, Dr. Wallen, could you comment on that too? You saw, Brittany, like a lot of us, want better hospitals where it's about healing, not coercion. What do you think, Jared? Is that huge PMA hospital possible?
That's a great question. I think from the standpoint of the marketing and such, I mean, obviously more from a elective standpoint, it's gonna be much easier. I think the one thing that we all know about hospitals and licensing and that type of stuff is that, you know, to a large degree, that's how physicians are controlled, right? And so the risk of losing your license or what have you basically goes away within the PMA, right? And so from that standpoint, it certainly allows a much more free market approach to any type of opportunity. So yeah, I mean, I think it's certainly plausible. One of the things I was going to follow up on with Dan was related to a question that you asked earlier. Dan, can you give the example? Because obviously these PMAs have been around for a long time. I mean, there's a very common example, I think, that you had mentioned to me previously regarding prohibition, right? And how, you know, I mean, to some extent, the government overreach during those times, you know, the PMA was actually a way that a lot of saloons and other, you know, businesses were able to continue to operate.
Right. Speakeasies. So if you went into a side of a speakeasy and you go through the little trap door and you go into a separate room, and those would be members back there and they could drink whatever they wanted to. Police weren't allowed to come in there at all. And another thing is with the DOs going back against the fighting against with the AMA a long time ago, they actually used this. The AMA was saying that we're a private membership association, so we can kind of push out the DOs, right, with insurance plans or whatever. I don't know the exact details on it, but it goes back. And so the AMA was fighting, saying that we're a private membership and so we can do what we want. And it went to court and it determined that the AMA is not a private membership because they helped write all the rules. They helped dictate the credentialing for different schools. They helped dictate the curriculums for different schools. And so because they're so publicly outfitted that way, they're no longer a private membership. And that's how the DOs were able to cut through that bargaining chip, and they weren't able to get ousted, I guess you might say, by the AMA.
Joe?
So, I mean, the hospital idea is brilliant, and I was even thinking a bigger like, could you almost make a whole community? Like, could you have a sovereign area of land that was like all part of the membership?
Sure.
That's awesome.
Sure.
And
You're
then,
a private membership. You can do anything that you want to basically in that private membership, as long as it's not clear and present danger. And as long as it's private, that the public, you have to be a member to get into the organization.
That's so cool. That's so cool. Two more questions. One, so doctors right now in the state of Florida, they have like their tier system if you're an outside doc, like to get your licensing. So if you live in state and you went to school, you get first crack at getting your license. If you went to school here, or if you're from out of state but went to school here, then you're like second tier. But if you like live out of state and you didn't go to school in Florida, then you're third tier. So it takes you like a lot of work to be able to become a doctor in the state of Florida before they'll license you. But essentially, a doctor could just avoid getting the license altogether by being part of a PMA.
Sure. In fact, I was in Austin and I thought I could treat disease here in Florida. I thought it was the only state that I was able to treat disease here in Florida. And so I came over here and I had to go back to school. And I've been practicing for close to 30 years now. And so because there wasn't, there was a part 4 of the boards that I didn't take back then when I was in school. And so I had to take that because that was a requirement for Florida. So I had to go back and study my brains off, trying to remember everything I learned throughout all the schooling that I did. And I passed the test and I came here to Florida. And then I hired up he was on the board for 27 years, a chiropractic board. He is the attorney. And so I sent him that article, John's article, how he talks about regeneration and stuff. And his reply to me was, I don't want anything to do with this. As far as I'm concerned, you're way outside the scope of chiropractic. And basically just said, screw you. I don't want anything to do with you. And so that was just like, and I already moved out here, right? And that's when I found out about John Jay. He is educating me all about the private education. That's when I called up Pro Advocate Group and they set me straight, say, this is how you do it. And if anything happens to me, that private, the Pro Advocate Group is there and they cover all my lawyer fees and everything. They cover me. So even if they do try to go after me, I just give it to them and they'll take care of everything for me.
Okay, I thought of another question, so I've still got 2 questions.
As many as you want.
For inside your membership, you teach this how to regenerate.
Sure, I can teach you how to do it. You can even treat. I'll certify you. I want to remain the high quality of care that I've experienced and how to get results. The other thing that we can do too in that is I can hone it right down to how many minutes they have to be on treatment for different diseases. what my percentage is that they'll get better. You know, it's X amount of percentage for this, and it takes this many days or months or a year or two to totally regenerate your whole body. I can do everything that way, and I can show other members. And I said, follow this regimen. This is exactly what you do. I can show you how to do it. And once you're there, in fact, what I plan on doing is I want to have an online course where people can learn this stuff online, and then I'll have my clinic where they can come in and get the personal touches and the experience of treating all these different types of things. And then I'll certify them, then they can go off on their own. They don't need my certification though, but if they want to be regenerate to heal PMA, I want high quality through there. So they do have to pass that. But you wouldn't need me to do that. You could just take it and do it on your own if you wanted to.
So still two questions. How long does that process take to learn? Like when you teach someone to certify them?
I've never did that before. I'm in the process of writing up all that stuff. I have most of it written up, but I want to do videos and I want to, you know, everything that I couldn't hold before, because if I held that, it would show I was treating disease or anything like that. So literally, I'm writing up that whole, that's my next agenda. I just moved here to Florida not too long ago, and I'm getting going right now. And that's part of the agenda right there. And I want to start taking in a couple of the pupils, and then I'll start writing up that whole program as there you go, as I'm starting to teach everybody how to do it.
Okay, that's super cool. And then how does the PMA work tax-wise? Like, is it kind of like part of tax-free wealth, or?
So John Jay told me to go, because he's all about being private. His risk management, that's what he's all about. So my private membership owns the LLC, and that's for the taxes only. So it'll go through the LLC and how I pay taxes. But I don't need that. It could go straight through the PMA, and I could get taxed that way as well too. But I like going through the LLC better. I like John Jay's.
Okay.
John Jay's idea. I would have him set you up that way. In the pro advocate group, I would definitely, because they've been doing it for 50 years for practitioners, and they know exactly what needs to go in there. John Jay adds a little bit more to it. Like he'll put in there like a, what is it called? It's for frivolous lawsuits or something like that, that they, liquidation damages, that they agree to pay you $1 million if they do frivolous lawsuits against you or anything like that. So like if an investigator came in and they signed this thing fraudulently just to try to get information on me to take me to court, you know, that I can use that liquidation damages against him. But even if they do take me to court, I'm not going to lose. It'll be in the PMA.
Was this all like ridiculously expensive for you to set up, or was it like pretty reasonable?
Not. Absolutely not. Pro advocate group, if you don't have anything legal going on, it'll cost you about 10 grand, and that's a lifetime thing. If you do have legal issues going on, they'll probably charge you about 20. John Jay, I think he's got a lot of money and he just wants to give this information. He's very much trying to help out everybody. And he didn't charge me anything for all this stuff. He sent me a lot of documentation. Now I'm going back through him to set up my LLC, and that's what he does all the time, and for privacy and stuff like that. So I'm going back to him to have him set all that stuff up, and that's what he's doing for me now. But he is very, very busy. I'll tell you that right now. And it's hard to get in to see him because he is good. He's good as far as knowing all the laws. And so I'm doing both of them. I'm a little bit paranoid because I've been in and out of this domain for a long time. It even bankrupted me at one time because fighting it and you have to stop practicing, and you know, it's turmoil. And so before I did it again, I'm 56 years old, and I don't want to lose my license, you know, so I'm having both these guys look after me.
Well, it does sounds like it doesn't even matter if you have a license.
No, but no. Even if I did lose it, I could do the PMA still.
Super pleasure to meet you.
It might be easier to buy like acupuncture needles and different things like that because you can't buy them unless you're a practitioner. But I could even sell those through the membership if I wanted to. I could even sell the machines. I could give you all the tools that you need. So, yeah.
Well, we're running out of time here. Brittany, you have a hand up?
Yeah, I've got two questions too.
Okay.
So is there an existing network of medical practitioners who are using PMAs that you know of?
I think that most everybody, and I'm just speaking for myself, but like I'm all set up and I'm ready to go, and I got all the education that I needed, and I'm going off,
If you're an employer and you're interested in solving your budgeting problem and doing a bit better.
Go ahead.
And so for me, I'm not really connecting with anybody and other PMAs, I guess, at this time. But I'm sure I'll find that group of people.
And then my other question is about being a licensed practitioner. So it seems like even if you're operating under PMA, you would still need to be licensed in order to do things like have access to prescription, to be able to write prescriptions and you couldn't set up a PMA, with a bunch of unlicensed doctors and still be able to get prescription medication to people, for example. Is that right?
Sure. Like as far as like I'm a chiropractor running you still need a licensing number because that is outside of the PMA, where unless the drug company is a PMA, and they could do it that way. I assume. I'm not sure. I'm not a lawyer. I don't know that, so I don't want to give any kind of unnecessary advice.
Well, could they also just use their licensing from their existing state?
Sure.
Like if they moved to Florida, for example, but they were still licensed in like Texas.
I guess if they had a legal address and stuff like that, and to prove it, I like I said, I don't know the ins and outs exactly on that one, but they would have to probably be in a state where they're licensed in order to get those drugs.
So I'm in touch with the PMA folks, and we'll have them present later this summer. But this is just the first conversation we're having about this. And again, we're having this conversation because the cartel is limiting what consumers want. So we're looking for folks who can solve that problem of artificial scarcity. BR, you got your last question.
You talked about physical disabilities. I'm talking about neurological or autism. Have you seen anything which is different and which can really help this population, this community?
For autism?
Yes.
Yes. Autism. I had well, it wasn't really autism. I never treated an autism kid before. But I've had bizarre things come to me. When you can regenerate the entire body, there's really not anything on the market that you can't tackle. The problems that we've had with is a gunshot wound or a knife wound right to the spinal cord. So when the spinal cord is severed, we can't get that back. Also, it's called spondylolisthesis on the pars in the back of the vertebrae, on the back of the bones in the vertebrae. When those break, we can't get those to regenerate. Alzheimer's, Parkinson's, the best we can do with those is just stabilize their condition so it doesn't advance further. And I haven't taken any of those, but John did quite a bit, and he wasn't able to reverse them, but he was able to stabilize them. Autistic kids, I did one of my wife's friend, she has a couple of autistic kids, and she's a pharmacist, and with the mindset of drugs are everything and alternative is not really that powerful. But I really did want to treat those kids, but I didn't have that opportunity. God bless you if you want to go that route.
Thank you.
And thank you, Dan. As we close here, tell folks how to reach you and to learn more about your services and PMAs.
On the very last slide there was for my Facebook ad. You can call me, or you can 512-800-0573, or my email is dr, my last name, Nofsinger, N-O-F-F, and then Singer, S-I-N-G-E-R, @regeneratetoheal.com.
And as always, the easier way to reach him or any guest is through me, whom you should know if you got the invite for the show. Thanks again, Dan. That was fantastic.
Thank you all. Take care, everybody.